Health Outreach Liberia, Better Health, Better Life, Health for One, Health for All. Once again, my name is Julius Kwanu, and I'm gonna be driving you through um, prostate enlargement in men who turn the age 40 from 40 upward, why prostate is very frequent in those ages, and then what are the causes of prostate enlargement in those men at the age of 40 and above. So just to drive you through, after the age of 40, for reasons that may be hormonal, the prostate gland begin to enlarge from 20 grams to many. It may grow to almost 100 grams. As it enlarge, it squeeze the urethra, and the man begin to notice change in the way he urinates from the age 40 and above. These are the reason. These are one symptoms and way to know that you have prostate enlargement. And then the change in the way of urination. Maybe you will not urinate with force. The force from your penis to shoot the urine out, it will not be. Sometimes it causes the urine to flow at your feet and don't go far, or like the little boys does. His urine stream is very weak and then cannot travel a long distance, and sometimes it comes straight down to his leg. Then we have something they call terminal draping, and then the men begin to notice that after urinating, urine still drop on his pants. After you have urinated, and then you shake your penis, and then whatsoever you wash or do whatsoever, and then you still feel that urination, urine still drop within your pants, then that means that you are experiencing something they call terminal dripping. And terminal dripping only occur at the age of 40 and above. People in 65, 66, 67, those are the cares that we need to give them now. As long as you reach to that kind of an age, you should know that terminal dripping may occur because your prostate has enlarged from 20 grams almost to 100 grams, and it also squeeze the urethra, the tube in which men use to urinate, and then the tube in which you use to pass on ejaculation, which is the sperm cell into the ovary. That time the passage of that area will be so small because of the enlargement of the prostate. The prostate enclose on the tube, and then it causes terminal dripping. Sometimes you urinate, and then after you finish urinating, you see still some drop within your pants. Then we get something they call hesistancy. Hesistancy, at this point you wait longer for the urine flow to start. Sometimes before you pull out your penis, and then you wait long time before the urine come out. That is hesistancy, for the urine to flow start. There are two valves that must open for you to urinate. There are two valves within the human penis, or the man penis, that open before you utter urination. We got the internal, the external valve, which are called the sphincter. Both open, but because of obstruction in the urethra, you wait longer for the flow to start. Hesistancy, that is it. It will occur because the two valves that are in your penis, they are called the sphincter. The sphincter, you got the external and you got the internal sphincter, and then it both open. They open, but because of obstruction, because of the closeness of the prostate enlargement, which has grown up to 100 grams, it can also make you to wait longer before the flow of urine starts. Then we got incomplete emptying. There's something called incomplete emptying. Unlike terminal dripping, you have this feeling immediately after urinating that there is still something left because of what incomplete emptying. After you finish urinating, and then you still feel that there is something within, some urine within your bladder that is altering further urination, but it's incomplete emptying. As all these things have happened, the bladder begin to work harder to compensate for the obstruction in the urethra. The frequency of urination goes up. Urgency set in. Sometimes you have to practically run into the toilet. Nausea also becomes common. you wake up more than 2 times at night to urinate. Whenever you reaches the age 40 and above, and then you need to take care of your urinary system. Your excretory system became very, very weak because of the enlargement of the prostate. Stored urine get infected. Oh, 1 minute. Just a minute. Okay, back to our topic. Stored urine get infected and there may be burning sensation with when urinating. Stored urine form crystal, and crystal come together to form stone either in a bladder or in a kidney. Stone may block the urethra. When you keep the urine too much, and then they will begin to form crystal. And crystal, when crystal join together, as we all know, crystal join together, it will form stone, and this stone, it will also help to block the urethra. Then the chronic urinary retention set in the bladder store more and more urine. The size of the bladder is 40 to 60 centimeter long. A bottle of Coke is 50 centimeter. As the bladder store more urine, it can enlarge up to 300 centimeter. It can overfill. Bladder may leak, and this lead to wetting and urinary incontinences. Also, the volume may put pressure on the kidney and may lead to kidney damage. What may likely bring the man to hospital is acute urinary retention. He wakes up one day and he is not able to pass urine, and then that condition is called urinary retention. Everything I have described above is associated with prostate enlargement, technically called benign prostate hyperplasia. That is the name for the condition, benign prostate hyperplasia. And there are other diseases that may also look like prostate, and we got the prostatitis, inflammation of prostate. That is one thing. And we have prostate cancer, cancer of the prostate. We have the discussion is on prostate enlargement. So we are not discussing prostatitis, we are not discussing prostate cancer, we are discussing why men at age 40 and above experience prostate enlargement and how prostate enlarge from the age 40 and above. Sometimes there's good news about it, and sometimes there is bad news. The good news is that there are lifestyle changes that can help the man after 40 to maintain optimum prostate health. One has to do with the nutrition. Look at what you eat. 33% of all cancers, according to the U.S. National Cancer Institute, is related to what we eat. 33% of all cancer in the world, it leads to what we eat. So nutrition play a better role in maintaining prostate health. And then red meat every day triple your chances of prostate disease. Milk every day double your risks. Not taking fruit, vegetable daily quadruple your risks. Vegetable daily quadruple your risk to prostate enlargement. So the intake of milk, and then the consumption of red meat on a frequent basis can also lead to prostate enlargement and can put you at high risk of prostate disease. Tomatoes are very good for men. If that is the only thing your wife can present in the evening, eat it with joy. It has load of lycopene. And what is lycopene? Lycopene is the most potent natural antioxidant food that are enriched in zinc and are also good for men. We recommend pumpkin seeds. Pumpkin seeds are also good in maintaining the health of the prostate. Amen. So I advise that men eat more pumpkin seed, or men you consume more tomatoes, because they are rich with lycopenes, and lycopene is an antioxidants food that are rich in zinc. and they have more zinc, and this zinc also help to protect you and keep your prostate life longer. Men need more zinc than women. Every time a man ejaculates, he loses 15 milligrams of zinc. And zinc is also important for alcohol metabolism. Your liver needs zinc to metabolize alcohol. So people who are alcoholics and who drink alcohol on a frequent basis, you are also advised to eat tomatoes, and then tomato contain lycopene, and lycopene contains zinc, and then you are advised to consume more zinc in your body so that your liver can fight against alcohol metabolism, the growth of alcohol that we call metabolism. So we're discussing also alcohol consumption, and as men begin to have urinary symptoms associated with prostate enlargement, it is important they look at alcohol consumption. More fluid in means more fluid out. The more you ingest fluid or you consume fluid, the more you pass out fluid. The lesser you consume fluid, the lesser you pass out fluid. So you should know. And men should maintain exercise to help build the prostate life, and also the immune system, and also muscular system. Exercise also help you to remain fit, and then your mental health also involved in it. Exercise help build the muscle tone. Every man should exercise. Men over 40 should avoid high impact exercises like jogging. It put pressure on the knees. Cycling is bad news for the prostate. We recommend brisk walking. As long as you experience prostate enlargement, you should exempt yourself from riding cycle. Cycling is bad news for you. You don't need to ride cycle. And then we just advise you to do brisk walking, which is walking by long, small, not jogging, because whenever you reaches the age 40, and then your osteoporosis, or the formation of your bone will start to weaken. So you don't need jogging and high exercise. High exercise will put pressure on your knee, and then you experience further complication. Then sitting. When we sit, 2/3 of our weight rests on the pelvic bone. Men who sit longer are more prone to prostate symptoms. Men who sit longer, they are more prone to prostate symptoms. And then they are at high risk of prostate enlargement. Like some of us who ride a motorbike, the keke, some of us who serve in the pharmacy, in the drugstore, in whatsoever capacity we might be. Some of us who are sit in the offices, and then some of us who are just home sitting and doing nothing, no exercise, nothing. We sit, we lay down, we sit, we lay down. You should know that you are putting yourself at high risk of contacting prostate enlargement. And if it happens, you know what are the conditions involved. You will experience terminal dripping, you will experience incomplete emptying, and all so forth. Do not sit for long hours. Walk around as often as you can. Sit on comfortable chairs. We recommend a divided saddle chair if you must sit long hours. So dressing also lead to prostate enlargement. Men should avoid tight underwears. It impacts circulation around the groin and heat it up. You better know that the scrotum wherein your testicles are found, they need 5 degrees Celsius. That is the temperature, the accurate temperature. So whenever you had on a tight underwear, it also compact the testicle and the penis together, and then it create more heat. And a bit, while the physiological temperature is 37 degrees, the groin has an optimal temperature of about 33 degrees. Pants is a no for men. Wear boxers. Wear breathable clothing. Don't wear tight. Those of us who wear those tight jeans, and then we put a tight boxer or honor it, it is forbidden that you should do that. You are also harming your prostate health. It also lead to prostate enlargement. Smoking. Avoid smoking. It affects blood vessel and impacts circulation around the groin. Smoking also affects the blood vessel, and then it affects the impact of circulation around your groin. What we mean by groin? Groin is where you find your testicle, your scrotum, your penis. That is the groin. Your we call it your private, but scientists call it a groin. Then sex. Regular sex is good for the prostate. Celibates are more prominent to prostate illness, while celibate say is moral decision. It is not a biological adaptation. Your prostate gland is designed to empty its contents regularly. So, for men, have sex regularly, and it is recommended that you have sex regularly to maintain your prostate health. And then the adaptation of your prostate gland is designed, your prostate gland is absolutely designed to empty its content regularly. The contents that you have in your prostate gland, which is the sperm, you need to empty it regularly. Though when someone shares something of value with you and benefit from it, you have a moral obligation to share it with others, because someone in your friend list might be safe. Thank you for listening, and this is another episode. This is just a health tip for women, and then if you follow it, you maintain your prostate life. Thank you. Health outreach, better health, better life. Health for one, health for all. Thank you for listening.